Introduction and classification of partial edentulous spaces. Need for classification. To formulate a good treatment plan. To anticipate the difficulties commonly to occur. To communicate with professional about the case. To design the denture according to the occlusal load. Requirements of classification. Allow visualization of the type of partial edentulous arch that is to being considered. Allow differentiation between tooth supported and tooth tissue supported partial dentures. Serve as a guide to the type of design to be used. Be universally accepted. Commerce classification. Diagonal. Two direct retainers are diagonally opposite to one another. Diametric. Two direct retainers are diametrically opposite to one another. Unilateral. Two or more direct retainers present on the same side. Multilateral. Three direct retainers in triangular relationship. Kennedy's classification. Class 1. Bilateral edentulous area located posterior to the remaining natural teeth. There are two edentulous spaces located in the posterior region without any teeth posterior to it. Class 2. Unilateral edentulous area located posterior to the remaining natural teeth, that there is a single edentulous space located in the posterior region without any posterior teeth to it. Class 3. Unilateral edentulous area with natural teeth anterior and posterior to it. It indicates a single edentulous area which does not cross midline of the arch with teeth present on both sides of it. Class 4. Single bilateral edentulous area located anterior to the remaining natural teeth. This is a single edentulous area which crosses the midline of the arch with remaining teeth present only posterior to it. Applicates modification. Class 5. Edentulous area bounded anteriorly and posteriorly by natural teeth, but in which an anterior abutment is not suitable for the support. It is basically a class 3 situation where the anterior abutment cannot be used for the support. Hence, it cannot be considered like a conservative class 3 edentulous space. Class 6. Edentulous area in which the teeth adjacent to the space are capable of total support of the required prosthesis. This denture hardly requires any tissue support. Most of the removable partial dentures are tooth tissue supported. Hence, this condition is classified as a separate group. Applicates rules. Considered to classify partial edentulous arches based on the Kennedy's classification. If it is diagnosed that any teeth require extraction, it should be done prior to the classification. 8 rules are given. Rule 1. Classification should follow rather than precede extraction that might alter the original classification. Rule 2. If the third molar is missing and not to be replaced, it is not considered in the classification. Rule 3. If third molar is present and is to be used as an abutment, it is considered in the classification. And rule 4. If the second molar is missing, it is not to be replaced, it is not considered in the classification. Rule 5. The most posterior edentulous area or areas always determine the classification. Rule 6. Edentulous area other than those which determine the classification are referred to as modification spaces and are designed by their number. Rule 7. The extent of the modification is not considered. Only the number of the additional edentulous areas is considered. The number of teeth missing in the modification spaces is not considered. Only the number of additional edentulous area is considered. Can be no modification area in class 4 because any additional edentulous space will be definitely posterior to it and will determine the classification. Newer's classification. It was proposed in 1939 based on support derived. It is not commonly used due to its unnecessary complexity. Class 1 tooth bearing, Class 2 tooth and tissue bearing, Class 3 tissue bearing complete dentures. Class 1 tooth bearing. A unilateral or bilateral case falls into classification when there are teeth posterior to all spans and when there is no more than 4 teeth missing in any space. Two variations. Variation 1 missing posterior predominant. Posterior missing, anteriors are in place. Posterior missing, some anteriors are also missing. Variation 2 missing anteriors predominate. Type A anteriors missing, posteriors present. Type B anteriors missing and some posteriors are also missing. Class 2 tooth and tissue bearing. A unilateral or bilateral case comes under the classification when there are no teeth posterior to one or more spans, or when there are no teeth posterior to one or more spans, or when there are more than 4 teeth in one or more spans. It is subdivided into division 1 and division 2. Division 1 when there are no teeth posterior to one or more spaces. Variation 1 under division 1 missing posterior predominate. Type A posteriors missing and anteriors are in place. Type B posteriors missing, some anteriors are also missing. Variation 2 missing anteriors predominate. Type A anteriors missing. Type B anterior missing and some posteriors are also missing. Division 2 when there are teeth posterior in all spans but when there are more than 4 teeth in any one or more spans. Variation 1 missing posterior predominate. Type A posterior missing. Type B posterior missing and some anteriors are also missing. Variation 2 missing anterior predominate. Type A anterior missing, posteriors are in place bilaterally and anteriors missing and some posteriors are also missing. Mock's classification proposed by Mock in 1942 based on the number teeth position of edentulous spaces and number of and position of the remaining teeth. Class 1 bilateral space with no teeth posterior to it. Class 2 bilateral space with teeth present posterior to one space. Class 3 bilateral space with teeth present posteriorly to both spaces. Class 4 unilateral space with no teeth posterior to it, the opposing arches unbroken. Class 5 anterior space with unbroken posterior arch on both sides. Class 6 irregular spaces around the arch The remaining teeth are single or in small groups. Skinner's classification. Introduced in 1959, classification influenced by Commerce classification based on relation of edentulous arches to the abutment teeth. Class 1. Abutment teeth are present anterior and posterior to edentulous space. It may be unilateral or bilateral. Class 2. All teeth are present posterior to the denture base which functions as a partial denture unit. It may be unilateral or bilateral. Class 3. All abutment teeth are anterior to the denture base which functions as a partial denture unit. It may be unilateral or bilateral. Class 4. Denture bases are located anterior and posterior to the remaining teeth and these may be unilateral or bilateral. Class 5. Abutment teeth are unilateral in relation to denture base and these may be unilateral or bilateral. Ababi, Ahmadian and Sharifi's classification, proposed in 2007 based on Kennedy's classification using numeric codes to classify partially edentulous arches. Rules for classification. Rule 1. Edentulous spaces are coded from the posterior right side of the arch towards the left side. Rule 2. Denote midline using the code 0 indicates. Following rule number 1, the number located before 0 indicates the right side of the arch and the number located after the 0 indicates the left side of the arch. Rule 3. Code 1 indicates a distal extension edentulous space. Rule 4. Every tooth supported edentulous space will be denoted by code 3. Rule 5. Anterior edentulous spaces crossing the midline are denoted by the code 4. In these cases, the code 0 will not be used. Rule 6. Distal extension edentulous spaces crossing the midline will be denoted by the code 5 placed before or after 0 according to the position of the edentulous arches. ICK classification system. It was proposed by Suleiman Al-Jonani and Carl Andres in 2008. Based on Kennedy's system, allows for incorporation of implants which have placed or planned to be placed in the edentulous spaces for provision of support for the RPD. Rules for classification. Rule number 1. No edentulous space will be included in the classification if it will be restored with an implant supported fixed prosthesis. Rule 2. The maxillary arch is drawn as a half circle facing up and the mandibular arch is drawn as a half circle facing down. Rule 3. The classification will always begin with the phrase implant corrected Kennedy, followed by description of the classification. Rule 4. The abbreviation MAX can be used for the maxillary arches and MAND for mandibular arches. The word MOD can be used to denote modification spaces. Rule 5. Roman numerals will be used for the classification and Arabic numerals will be used for the number of modification spaces and implants. Rule 6. Tooth number using the universal system or FDI system can be used to denote the number and position of implants placed or planned. Rule 7. Classification will follow the order of main classification and then the modification spaces and the number of implants. 8. The classification can be used either before or after implant placement. Rule 9. The name ICK classification system is given to differentiate the system from other partial edentulous arch classifications. Thank you.